This is Caleb from TASC at the National Rural Health Resource Center. Today we have Joshua Scales from, where did it go? United Health. I'm sure he'll fix my pronunciation. A company focused on helping providers and organizations with developing digital and virtual health strategy. He has a wealth of experience and knowledge in telehealth strategy, implementation, regulatory compliance, population health management, and overall healthcare operations. I was really excited to chat with Josh when given his name to possibly help us with the Learning Collaborative for this session. So after chatting with him a couple of times, it seemed like he would be a great fit for us and our group. So Josh will go through telehealth with us, and the same kind of rules apply as before. We'll have some presentation and then time for questions. If you do have questions as we're going, please do utilize the chat box, raise your hand in the Adobe room, ask questions if you have them, but we should have plenty of time at the end for questions if you'd like. This is the last of our regularly scheduled Learning Collaborative meetings. We do have available one-on-one action planning sessions that you can let us know if you're interested for, and that really does break down to sitting there for a half an hour with me while we discuss your action plan items and we go through what outputs could be and what outcomes sound reasonable and how that might work into the work that you're already doing. We met yesterday and had office hours. We had a few participants there. The recording either is or will be available shortly, and that'll be posted to the Teams world. We will be looking for action plans by the end of, I believe, the end of next week. Is that correct, Andrew?
Yep, July 3rd.
So July 3rd, before you guys go on vacation, is the deadline that we would like to have action plans. So let me know if you need some help filling that out, making sure it is good for you and your team. The file share box on the bottom left is where you can find the template for the action plan, as well as the homework for today's session and slides for today, as well as the list of resources. So without any more time taken away from our discussion on telehealth and mobile health, I'd like to welcome Josh Scales.
All right, thank you so much. Thank you so much. Let me see here. All right, so good afternoon, everyone. My name is Joshua Scales, founder and CEO of Unity Health, and I'll be your host for today's webinar. We'll be discussing ways you can leverage telehealth to support your current population health efforts. All right, so this is just a disclaimer, just stating that any information provided in today's webinar is not to be regarded as legal advice. The talk today is purely for informational purposes, and always consult with your legal counsel. Here's a list of the topics that we'll discuss today. We'll start out, kind of discussing telehealth in its current state. We'll touch on some of the pre-COVID-19 information, go into some population health basics, and then move kind of into some of the telehealth modalities and how you could possibly use them to help accelerate your population health efforts. And then we'll discuss some of the barriers, and then we'll move into the next steps. Feel free to ask any questions you may have. I know we're going to save some time at the end for questions, but I want to make this more as conversational and open as possible. So feel free to send me a question in the chat, or just hold your question to the end, and either way, it'll be fine. All right. So the current state. So before COVID, telehealth was riddled with many restrictions that was really the cause to a lot of providers hesitating on adopting telehealth on a mass scale, right? So pre-COVID, there were tons of restricting geographic limitations, distance site limitations, a limitation of eligible providers, eligible services, licensure issues, and lack of reimbursement, just to name a few. But now, since COVID has happened, which has changed the landscape of healthcare for the whole entire world, as I see it, a lot of things have changed. So if we fast forward to today, you have CMS has extended access via the 1135 waiver, and with the CARES Act, which I'm sure most of you are familiar with. And now they've added 80 additional services to the eligible services, in which I'm referencing Medicare as we speak. And even the commercial payers have also extended reimbursement and waived some of the patient cost sharing. And then the state Medicaid plans have made temporary policy changes to support the expansion and adoption of telehealth. And even our good friends at HIPAA have relaxed some of the requirements to help, mobilize physicians and give them the ability to find technology that they can use to administer the virtual visits. So if you really look and think about where we are, I know me, I've been advocating for telehealth for the past 4 or 5 years. And it's always been a difficult conversation, and the difficulty of the conversation vary depending on who I was speaking with. But now, since COVID has happened, we've seen the whole entire world kind of get a taste of digital and virtual health, and how quickly physicians can mobilize and actually implement a program in a situation where we have a national emergency like COVID. It actually works, But a lot of organizations throughout this whole COVID process, they experienced a 40 to 50% drop in patient volume, which resulted in massive loss of revenue. Tons of healthcare organizations had to furlough staff to remain operational due to the lack of revenue. And what we've really seen with this whole COVID pandemic is healthcare organizations using telehealth to manage their populations. So when I look at the whole entire aspect and the whole entire picture of it all, and how physicians have been using digital and virtual health to, for one, expand access and minimize the exposure, it is a prime example of how you can use this actual modality to provide care and manage care for a population. So I think that we have an extremely positive outlook moving forward, and I'm excited to see what holds post-COVID, in which it's not going to be the normal, which everyone is calling it the new normal. So I'm happy to see what that's going to be, but I'm very positive on the outcome in the near future. So speaking on the new normal, again, kind of like I just alluded to, is that due to the rapid response related to the pandemic, everyone in the world has had to take the digital and virtual health. So for organizations like yours, it's going to be important for you all to think through how do you normalize a virtual health program moving forward? Because what we've seen is that physicians are scaling up these programs in 1 to 2 weeks of time due to the urgent emergency of continuing the care of patients, and also taking care of those patients that's presenting with symptoms, with COVID symptoms, and making sure that they're chronic care patients, that they are already managing are safe and have the medications and the services that they need. And another thing, especially when you're working in a rural area, another thing you have to think about with the emergence of digital and virtual health, the competition is going to grow, because when you look at it, if you're a rural critical access hospital in Virginia, okay, and you're going through your strategic planning process and you're looking at your market share, and you maybe have, say, one or two competitors within a 50 or 60 mile radius. I'm just being conservative, so don't quote me verbatim. Now you have to think about the possibility of an organization in Arizona encroaching on your market share virtually. So when you think through telehealth and how it can benefit your population health, you also have to think about, okay, from the marketing aspect, as we develop these programs, how do we market it in a way so we know that we can retain those patients that we are currently providing, that are currently part of our population health management program, but we can also appeal to those new patients so we can keep the market share in our own communities. So it's really changing the aspect and the outlook, and that's even for critical access hospitals, FQHCs, rural care clinics, etc. It's really changing the aspect and the way these leaders look at, okay, the strategic plan and how they're going to move forward in this virtual environment. So I'm excited to see what happens next after COVID, but now is the time for organizations to really start thinking that through. And especially if you already have an existing population health program and you already have population health management plans and action plans and processes and procedures in place, it's a great time to start thinking about how digital and virtual health can help you accelerate that. All right, so this next definition, and what you'll see in telehealth is that telehealth and telemedicine are commonly used interchangeably, okay? And depending on what professional organization you follow, there's a different definition of what telehealth or telemedicine is. Well, for this webinar's purposes, I chose to go with the American Telemedicine Association's definition because they're the #1 telehealth organization in the country. So this telemedicine, and I like it because I think it's short, sweet, and straight to the point, which is telemedicine is the remote delivery of healthcare services and clinical information using telecommunications technology. I think when I look at all the different definitions, I think that one is just short, sweet, and straight to the point. And I like this particular definition because, again, as you navigate and you actually work through the telehealth environment and the digital health environment, you will hear different organizations using those two words out interchangeably. But I always stick with the American Telemedicine Association when I'm referring back to a definition or a certain regulation or et cetera. And there's other organizations that you can pull information from, but I recommend using ATA for those types of resources. All right, so here are a few stats to give you an idea of the increases of virtual health adoption since COVID, okay? And this is according to McKinsey. 11% of U.S. consumers using telehealth in 2019 has increased from 11% to 46% of consumers that are now using telehealth to replace canceled healthcare visits. So if you see that number, 11% to 46% is a drastic increase, but it makes sense because with COVID, there were tons of canceled appointments because patients were scared to go to the doctor in fear of obtaining the actual the virus. But it shows how quickly consumers actually picked up on the benefits of it and how convenient it was and how they rapidly started using it and demanding it from the provider. So that is just one stat that I really thought was amazing. And then the next one, that providers have seen a 50 to 175% increase in patient visits since COVID started. And that's from 2019 to now. and with such a short time, it's almost triple of what it was now. The increase in virtual visits was already at 50%, and that's kind of an indication of, there was a few pieces of legislation that was being pushed down that was already supporting the adoption of telehealth, and consumers were becoming more familiar with it. But me personally, I think that the COVID was a template point, really, to show people and consumers how easy and beneficial virtual health can be to your everyday life. So this is a great show of how quickly that can happen, and how people caught on to it, and they're actually using it for their own benefit. So I thought this one, and then I have another one. And this was from a study that was done by Deloitte, and they're stating that by 2040, 42% of outpatient services will migrate to a virtual setting. Now, if you look at that number, for me, I think that's very staggering, because, from a population health perspective, outpatient services are like one of the key things into maintaining a good program. And when you tie in the care coordination piece from outpatient to inpatient, and then managing those chronic patients, a lot of the work is done in the outpatient and in preventative areas, right? So with that, just keep that in the back of your mind, is that by 2040, 42% of outpatient services are possibly going to migrate to a virtual setting. So as you go into your planning and you start putting together new processes, new pieces of technology, and you take a look at your population and look at the outcomes, and then you start to plan for the next few years. Just keep that in mind, because that's just a clear indication of how that the industry as a whole is seeing the virtual and digital health market to really expand throughout healthcare industry moving forward. So, but I thought that was a good one too, and it's from Deloitte, which always give great, reputable information. All right. So this is a definition of population health, which, and the only reason I put this up, and I pulled this from the American Hospital Association, is because I think it is short, sweet, and straight to the point. Population health is the outcomes of a defined group of people, including the distribution of such outcomes within the group. Now, what I've also noticed is that I've worked with a lot of groups and have been in a lot of engagements with organizations to where population health and population health management is used interchangeably. So when you talk to some groups, depending on who you speak with, they may be referencing population health management, which is the action plans and the processes and procedures and the things that you're going to put in place to help those patients achieve those goals. And then some use population health. But for this definition purposes, I thought that using the definition for population health would be best, but just showing kind of how with telehealth and telemedicine, population health and population health management can also sometimes be used interchangeably. This is another, just a quick basics of population health, like with regardless of what program you're working on or what you're developing, if you have a clinically integrated network, whatever the situation may be. These 6 things are, to me, some of the most important things when it comes to the foundation of your program. For one, the data aggregation, having the ability to aggregate the data. So for one, that you can analyze the data as an organization is extremely important. 2, the patient identification process. So without the data, it's almost impossible for you to identify the patient population that you need to focus on or that you're going to include in your population health program. So the patient identification piece is very vital. 3, care coordination. Care coordination is all about closing gaps in care, and that's one of the most important things when you're trying to care for a critical care population or patients with multiple comorbidities, is ensuring that they get the care that they need and they have access to the care they need. Number 4, patient engagement, which is extremely important, because the more you engage the patient about their condition and the more access point and touch points you have with that patient, the better off the patient is and the more educated they are about their condition. So that retrospectively helps with the improvement of the overall care for that patient. And then 5, the performance reporting, because you have to know okay, we aggregated the data, we selected the patient population, we put these processes and procedures in place. Okay, how do we report out with this information to our board or to the leaders of the clinically integrated network or whatever, however your program is organized? So you have to have the performance report. And then 6, the administrative and the business side of it, is to say, okay, we had the program, it's been operating for 2 years. How much money did we save? How many lives did we save? How many unnecessary ED visits did we divert? So that's really, when I saw this particular Pop Health Basics, I thought these 6 things were very strong, regardless of what type of program you have or where you're located. These are 6 very important things that every organization should think about. Okay, so the big question: how can telehealth help? And when I look at things, understanding and being involved in telehealth and population health for some time now, the 3 things that come to my mind is increasing patient engagement, expanding access to care, and improving care coordination. And those are the 3 things that a lot of organizations have been trying to achieve for a long time, which birth population health and PCMH and all these other programs that has been out of the spectrum when you think about the major aspects of doing these things and doing all these things effectively. But when it comes to increasing patient engagement, improving the provider-to-patient relationship, improving the patient satisfaction, educating patients better on their chronic care management, those are very vital to any population health program. If you have a program and the patient is already well educated and the patient satisfaction scores are extremely bad and there's no provider-to-patient relationship, your program is destined to not perform very well. So those are ways that telehealth can help by increasing those access points and expanding that access to those patients. Now, expanding access to care, just as well as I do, when it comes to, especially in rural areas and you're dealing with chronic patients, the more access to care and improved access to specialty care they have, the better off the patient will be. And then also providing patients access to care regardless of their location. And now when you're dealing with a population, especially in the Medicare range, some patients may not be mobile. So what kind of technologies and processes and procedures can you put in place to ensure that regardless of where that patient is located, either in a assisted living facility, in a nursing home, or at their house, how do you connect with those patients virtually and still able to provide them with the type of assessments and care that they need to continue to help them manage their current conditions. And then just convenient access points. Because convenience is anything that's easy for patients, especially in rural areas. And a lot of patients are commuting, anywhere from 30 to 40 miles to see specialists in certain hospitals. So the more convenient you can make it for the patients, the more improvements you'll see in your population health program. Generally, what I've seen in the past. With care, convenient access points is a major piece of it. And then the last, improving care coordination, and which is kind of like where it all starts. So when you close the care gaps, that means patients are getting the care they need, their numbers are improving, they have their medications, they're compliant with their medication adherence, etc. And then you also have to utilize data and business intelligence to improve the health outcomes. So as you get the data from, either implementing a digital or virtual solution, you use that data to plan for, the next few years, the next strategic plan that you put in place so you can better support your population. And then also telehealth supports the overall value-based care delivery. And you can use telehealth to do that in many different ways. So when I kind of thought through how can telehealth help, these were the 3 things that kind of really stood out at the top of my mind. And I think that, regardless of your program, where you're located, reimbursement, etc., there's ways you can get creative and use telehealth to help accelerate what you do. And next, we're going to start talking through some of the different telehealth modalities and how they can benefit, your organization and your population health program. So a lot of virtual visits, which is synchronous telehealth, which is one of the most popular versions of telehealth and can be used to support, different areas of operational and clinical improvements. For one thing that really stands out to me is that, a lot of organizations have used telehealth to increase provider capacity. And as well as I do, we operate in a population health program. Provider capacity is one of the key things, and many providers in rural locations are very busy because, they're normally, especially from a specialist perspective, there's a limited amount of specialists and a limited amount of access to those specialists. So increasing that capacity by using digital and virtual solutions is very important. And it also can help organizations generate new revenue. So as you're implementing these population health programs and you're thinking of ways to include, telehealth or live virtual visits or sequence telehealth in their programs, it also can help free up time of your physicians to where you could possibly go out and capture new patients or spend less time working on the lower acuity patients and spend more time working on the higher acuity patients, which in retrospect will improve your quality scores, which in retrospect increases your revenue there. So that's something to think about too, but there's many different ways that live virtual visits can help generate new revenue. It just depends on the issues that you have at hand and where your problems are, so you can really focus and use the technology to mitigate those issues. The third thing is it can help you decrease readmission rates, because with most population health programs, the goal is to keep the patient out of the hospital. So, and especially if you're dealing with, CHF, COPD, hypertensive patients in a rural area with multiple comorbidities. After hours, they have a situation to run out of medication, patients go to the emergency department. And if you can use synchronous telehealth or live virtual visits in a fashion to where you can use it as an ED diversion technique within your population health program to make sure that those patients who may just need a refill on their medications or just having difficulty operating one of their peripheral devices that they have at home, that you have a virtual connection that you can connect to them with and help them, so you can divert that unnecessary emergency department visit, which in retrospect will help improve your organization's overall readmission rates. So that's another way that I've seen it, and I've helped a lot of organizations from a strategic perspective. When it comes to decreasing readmissions, use certain forms of telehealth to do that. So that's a very common way. So that's another thing to take into consideration. And then fourth, it can help you avoid costs. So if you look at the supplies costs that you use for, from an outpatient perspective, you have all these patients come in for follow-ups or visits that maybe not is low acuity visits, but maybe they just needed to talk to the physician about results or review or EKG or whatever the situation may be. You can convert let's say a subset of those to a virtual visit, in which will save your group or your hospital costs tremendously when it comes to supplies. And also, you have your patients who travel from all different locations to come see your physicians or specialists within your population health program. So you got to think about the time it takes them to drive. So not just on the organization side, you can also save the patient's time and money by implementing a virtual presence within your population health program. So, and even if you have physicians that may be driving out to other rural locations to, once or twice a week to see patients, you can cut down on some of that windshield time there too, which in retrospect would save the organization money, because you think about the gas, the room and board that the physician has to stay overnight, or all the other costs associated with a physician going to a satellite location and providing care. That's another way that live virtual visits can be implemented into your population health program strategically, and also coupled with, other initiatives that you have going on within your hospital to make sure that you guys are using the provider's time efficiently, and you're also using the technology to accelerate what you do at the same time. All right, next we're going to go into, I have two examples. And if you guys are familiar with telehealth, you're familiar with patient, provider to patient, which most call direct to consumer, and then provider to provider, telehealth, right? But with direct to consumer is one of the most popular versions of telehealth today because it's mainly offered through all employer-sponsored insurance plans, and even all of the main payers have telehealth programs. They partner with some of the big, the top 3 telehealth providers in the country to provide that service to their policyholders also. So, but with provider to patient, this is another way you can create additional touch points with your patients that are within your population health program, right? So as you have the congestive heart failure patient that may you sitting home with peripherals and a scale and all of the other Bluetooth peripherals that you would send if you're using that type of technology in your program, as the patient has a question about a particular result or a particular method or process that they may be new to the program, so they're not comfortable with doing it in-house, so they may have someone who's a caregiver or a granddaughter or a grandson, or whatever situation may be. You can create touch points with the doctor virtually just to provide more comfort with those patients, to make them more confident in the program that they're participating in. Because what I've seen is a lot of organizations implement these population health programs, and they send a subset of patients home with a bunch of Bluetooth peripherals and things to use. But when the patient has questions on how to use it, if they don't get a rapid answer or access to someone who can help them, they normally don't follow directions of the program, and they normally don't take the results they're supposed to take. They don't do their weights. They don't take the medication. They don't log the information if it's a manual platform. But just creating those additional touch points for those patients from a direct-to-consumer perspective could be very beneficial. Now, from a provider-to-provider perspective, this is very, very, very popular in rural areas also. And this is where you may have a critical access hospital that lacks access to a full-time psychiatrist or a full-time neurologist or cardiologist in a sense. And the patient needs access to that particular specialty, so they go to the actual facility and meet with the clinicians on your staff, and then you have access to that particular specialty. Well, that's another way to give those your population access to that board-certified specialist without inquiring the cost of hiring a full-time neurologist, full-time interventional cardiologist, etc. Those specialists where it's hard to come by in rural areas, because a lot of rural areas have really difficult times recruiting those niche specialties to their areas in which they can go 1 or 2 years without having it, which in retrospect means that your patient population is going without that particular access, or they're either going elsewhere to receive that care. So from a population health perspective, provider-to-provider telehealth has been big, because I've seen organizations use it to educate different providers who, let's say you have a hospitalist who's not well versed in stroke care, and you have a patient presents with, presents with stroke-like symptoms. Well, now that hospitalist has the ability to reach out to a board-certified neurologist and ask questions or get their feedback on a specific case. Then the neurologist sends it back, and then your group and your physicians are able to care for that patient and not send them outside the 4 wall and not send them off somewhere else to get that care if you're comfortable with it. So these are just 2 very common methods of live telemedicine, provider to patient and provider to provider, in which if you all are familiar with telehealth, I'm sure you've seen it, or you're probably already doing it. But I think these are 2 very beneficial ways that you can use to support your population health efforts. Now, the next one is remote patient monitoring, which is where I think telehealth and population health kind of meet, right? This is like that sweet sauce that, when you're trying to implement a program, you have technology and you have the processes, but it's kind of hard to get them all to kind of like fit in this kind of like sticking a square peg in a round hole. But I think remote patient monitoring and population health management specifically has a good relationship. So remote patient monitoring, all it does is pretty much uses digital technologies to collect health data from individuals in one location and then electronically transmit that information securely through healthcare providers in a different location so that provider can assess and provide recommendations. With that being said, providing that access to a group of congestive heart failure patients that you're monitoring on a daily basis is extremely beneficial. So for one, it'll help improve management of the CCM population because it gives those physicians that real-time visibility into each patient and the trends, that they see from a results perspective, the lab results, and all the other things that come into play when you're managing a patient with a condition such as congestive heart failure. So it helps them intervene in time to where you could, for one, save a life, or you could divert a particular ED visit if the patient, if you were able to intervene in a timely fashion, you could be the difference between that person going into the emergency department or not. And then it also can improve provider efficiency, right? Because with having real-time visibility into your patients outside of the four walls of your organization, your provider can actively monitor each patient based on severity to make suggestions and medication changes and adjustments to the dosage of medications real time, just to ensure that your patients are level and that patient is getting the care that they need and the right doses that they need right then and there. And then that kind of moves into the whole improved medication adherence, because with chronic condition, medication adherence is one of the most important things. Making sure that patients take the right medications at the right time, and that they understand the certain medications you can't take at the same time due to certain drug-drug interactions. It is big. And with a lot of organizations I've worked with before, just improving medication adherence has been one of the toughest problems. But when you implement something as complex as remote patient monitoring, and you have doctors who have access to a platform that is continuously feeding them data, and that they also have access to communicate with that patient in real time. And it doesn't have to be the physician, it can be a nurse, care coordinator, whatever the situation may be. And then just to communicate with that patient and let them know that the changes you made and the recommendations you make in real time can really be the difference in a person improving their overall healthcare situation or not. And then fourth, it improves the intervention response time. I mean, most of the times, if physicians don't have this type of technology in place to where, especially for the critical care population, and if you're not aware that your patient is in the hospital, or if your patient is having difficulties with any of the medication or with their condition, doctors don't find out until they're actually in the hospital or being released from the hospital that their patient was actually in the hospital. So this real-time intervention response is extremely important, because for one, it enables the physicians and the clinicians with the ability to have direct contact and direct visibility into their patient's health at all times. Now, the type of remote patient programs vary. You have some that are very disease-specific. So if you focus on diabetes, or if you focus on COPD, or you focus on CHF, there are a lot of different pieces of technology that you can actually obtain. But then you have the pieces of technology and platforms that you can do it all on. So, but when you get into remote patient monitoring, it's very beneficial, especially with the population health platforms. And it's good to know, when you're working with your population and you have these relationships with these different payers, and you're trying to decrease costs because, due to an initiative, a payer-provider initiative that you have already discussed with your managed care group, whatever the situation may be. It's good to really do your due diligence on the front end, so you don't have to worry about working through all the kinks on the back end. But I think remote patient monitoring is the perfect mixture with population health management to help improve the health for chronic care patients within populations. So I'm huge, and I really think remote patient monitoring is the next big piece of telehealth to really take off. Like virtual live visits is a thing of the past. We're all familiar with that because that's been going on for a while now. But with remote patient monitoring and wearable devices, and iWatches and iPhones, and you got all these other pieces of technology that are becoming FDA certified health technologies, and now you can use them. You can equip the patient with one of these devices, and it feeds information back into your EMR platform or whatever third-party platform you may be using. I think there's only going to continue to grow when it comes to managing populations, especially those with multiple comorbidities. So I would really spend a lot of time looking through remote patient monitoring and figuring out strategic ways to use it to help support what you do. Now, this next slide, this is a typical example of how a remote patient monitoring platform works. So if you see on the left, you have the patient, and there's a patient that has a smartphone, and then they have the weight scale, and then they have the blood pressure meter and the pulse meter, right? So as the patient takes that information, it's then funneled through a platform that goes through a server, et cetera, and then it's available to the physician or nurse on the web interface. And that's just a clear example of how if patient A is at home and it's 10 o'clock, well, let's say patient A is at home and it's 2 o'clock in the evening and they just took their A1C, and the nurse gets an alert on the web interface saying that this patient is, extremely outside of the normal parameters, then that nurse can immediately, or nurse or physician can immediately pick up the phone and call that patient and intervene on that situation to figure out what's going on with that patient's care. But I really like this visual because it's kind of simple, and it technically just lays out how the patient has their peripheral, the physician and the organization has the technology they need, and everything that happens in the middle to make that all successful. All right, so storing forward technology, which is defined as asynchronous telehealth, which is, it's transmission of recorded health history through electronic communication systems to a practitioner. And it's usually a specialist who informs or evaluates a specific test or lab or diagnosis outside of real-time or live interaction, in which this is very important because it can help providers scale at an efficient time and manner, right? Because storing forward is not live. So the physician doesn't have to be there readily available if a patient needs it now. They can actually do it on their own time. So as they're seeing patients throughout the day, they can use the admin time to go through some consults that's been sent to them via storing forward, either by another practitioner or by a patient. And in the next slide, we'll kind of get into some of the different versions of storing forward that you guys may be familiar with. But for one, storing forward can help decrease wait times. Because I know with a lot of specialists, and from a preventative perspective and an outpatient perspective, they're constantly booked. They're constantly booked with either new patients who have new issues or current patients that they're just following up with to check and to make sure things are okay. So when you provide a platform, a piece of technology to where it gives the doctor the ability to receive maybe an image or lab results or x-ray, and then they can review it on their off time, so when the actual appointment comes around, that appointment is a lot more faster and a lot more efficient, which in retrospect, frees up more time for your physician to see more patients. So storing forward in which I think that it's a very beneficial, but it's mainly normally used in, radiology and dermatology, because those are two of the two top service lines that I think they utilize this type of telehealth. But and it also helps minimize unnecessary prescriptions and procedures, right? So if I'm a dermatologist or if I'm a patient and a rash comes up on me and I'm getting concerned about it and I'm thinking about going to the emergency room, you can snap a pic and send it to your dermatologist, and then they can reply to you in a timely fashion to let you know, yay, you need to go check into the ER, or no, it looks just like an XYZ rash. I'm going to send you a prescription to your pharmacy of a topical ointment, and call me, and I'll call you in 2 weeks. So there's so many different ways that storing forward telehealth can help an organization, and especially with population health. Depending on the specific disease or condition that you're focusing on, there are multiple ways that you can use storing forward to help accelerate and improve what you're currently doing. And thirdly, optimizing the provider schedule. Providers have busy schedules, and especially if you're dealing with a surgeon of any sort, they're doing surgery a certain amount of days, they're in the clinic a certain amount of days, so their schedules are booked up, double booked most of the time, seeing patients when they're not in the hospital. and then when they're in the hospital, they're doing what they went to medical school to do. So using Storm Forward, you can help optimize their schedule to where they have a certain subset of time where they can apply to certain consults that are either sent by other practitioners or other organizations that they may have some type of collaborative agreement with, or even directly from the patient to where they can review and then write their thoughts and reply and send back to the patient and let them know either A, yes, you need to schedule a visit with me because it's concerning, or B, no, you're looking good, I'll see you at your next annual follow-up, etc. So using Storm Forward to optimize your provider schedule while you're running this, a population health program is very important. Now, if you have a clinically integrated network, that can get kind of tricky too, because you have so many different providers, even internally and externally participating. So trying to do it on such a large scale can be quite difficult depending on the capacity that your organization has. But if you're doing it on a smaller scale, a medium-sized scale, for a smaller population and a smaller organization, it's perfect for optimizing. But you just have to make sure that you strategically do due diligence up front to know exactly what you need to focus on so you can put the right processes and procedures in place. And Storm Forward has really kind of rose to the occasion when the patient portal utilization starts to increase, right? So pre-meaningful use, post-meaningful use, patient portals were the thing, right? Everyone was using it, right? But as technology started to advance, a lot of organizations started using other third-party pieces of technology to communicate with their patients. And if you're in a hospital or a large healthcare organization and you have both inpatient and ambulatory, if you're not using one integrated system, the whole patient portal thing can get quite confusing. But with a lot of organizations now that I see that have very, very strategic and lucrative telehealth programs, they do a lot of the Storm Forward telehealth through their patient portals. So if there's any images, any messages that need to be sent to the provider or to one of the clinicians in reference to their current condition, medication, or a post-op procedure, or whatever the situation may be, or a follow-up, they route that traffic through the patient portal, because the patient portal does all of that and much more. So as you're thinking about this and you're working throughout your population health program and putting together your strategy, look at your technology, understand where EMR vendors you use and the capabilities that your patient portal has, because there's a lot of that you can run through the patient portal and still have a lucrative program, and you're capturing all that information in one place. So you're not really having to do it outside of your system and then integrate with another system, and then you have to pull the data from that system. So really now is a time that patient portal kind of died down for a while after the meaningful use money stopped coming in for a lot of organizations. But now I see it coming back as more and more organizations are starting to adopt virtual health, especially around the dermatology and radiology and those specialties who use it quite often, but where I see it most commonly used, to put it that way. All right. So examples, again, like I referred to teledermatology and teleradiology earlier. So an example for, you have a dermatologist and a patient, right? I'm a patient, I see something on my arm, I start to freak out, like, oh my God, what is this? So I take a picture of the particular location, send it to my dermatologist just out of nowhere, because I just recognized it when I was in the shower, right? And let's say within 24 hours, that dermatologist sends a response back to me, giving me instructions on what they recommend me to do. Now, with that being said, now I don't have to actually, if he says everything was good, I sent you a prescription, now I don't have to go sit in someone's waiting room for 2 hours, right? I don't have to go to the emergency room. Now I just have to go pick up my prescription, go home, follow the instructions. If it doesn't go away, then I can call a dermatologist back and schedule an in-person appointment. That's one of the ways that a lot of dermatologists are using Storm Forward technology. And there's a ton of apps out there now, and they're not very expensive. There are free apps even for dermatologists that you can download on your iPhone. And you can tell your patients to download it also, and they can send pictures to you securely through an encrypted platform, and that's, let's say if you're not utilizing your patient portal effectively, right, and you just need to find a way to do that. That's a quick way to do it, or else you can do it all through the patient portal. So that's just one example, how dermatologists are really rapidly expanding and using telehealth across the nation. I mean, every time I talk to a dermatologist, that's the first thing they want to talk about. Like, how do I do this? How do I get paid for it? And how do I partner with other organizations? And I've seen a lot of strategic partnerships through dermatology groups and, let's say, certain hospitals and certain FQHCs and certain community health centers in reference to provide that care, to where if they have a patient that presents with something and they're not familiar with it, they send it to the dermatologist within 24 hours and send a response back. And then, that organization knows that they can either refer the patient elsewhere, or they can just provide the instructions that the dermatologist provided and the patient could go home and relax. And teleradiology is another one that's really common, especially when an organization doesn't have a full-time radiologist on staff. You may have the equipment, where you take the x-rays, you do the MRIs, whatever the situation may be, and then you have a radiologist that's at a distant location that's reviewing those tests and sending back their interpretations to your organization. So with that's been around for a long time. So again, if you guys are familiar with, are you in the telehealth, even if you're not in the telehealth business, a lot of groups are using teleradiology, but they really don't know it. But that's just two examples of Storm Forward that are more popular. And with each of these examples, there's multiple ways that you can implement programs or certain service lines to help support your population health efforts. Pharmacy is another big one that I start seeing a lot of groups get into, to where, they have a pharmacy at a distant site. A pharmacist at a distant site that are reviewing certain information within their EMRs and making adjustments to medication and sending it back through their system, and then they're prescribing it through the system. Then the patient gets what they need. For in retrospect, they save that group a lot of money, to where they have a collaborative partnership and not a full-time pharmacist or 2 or 3 full-time pharmacists on staff. So that's a very common one that I see a lot throughout the healthcare industry too. But again, regardless of what service line it is, you can find ways to strategically implement programs, either using Store Forward, remote patient monitoring, or live virtual visits to help accelerate and help complement what you do. The main thing is you're making sure you nail down the issues, and even when you start talking about socio-economic issues and things of that nature, there are multiple ways to interface this technology in to help you improve on what you're doing from a population health perspective. Now, next slide is talk about. Oh, go ahead, man. I'm sorry. You got a question?
Question in the chat box that I want to catch before we keep going. We got some that'll keep, but while we're on the topic of like teledermatology as an example, hey, how is that type of visit, that impromptu visit, billed? And then what do you do when you identify something like that, but you don't have that specialist already identified in that relationship built?
Now, normally with teledermatology, if you're in a state that bills for Storm Forward, and you have a parity within your state, then they should bill at the same rate as they would if it was an in-person visit. Okay? Now, with that being said, every state, depending on if you're talking Medicaid or Medicare, they don't bill for Storm Forward at the same rate. So you got to make sure you pay attention to your state and federal laws, and if you're in the payer that you're using when you're doing this. But if, let's say, for instance, if you run across that situation and you don't have a dermatologist on staff and you're trying to figure out, okay, what do we do now? Because some groups just don't have dermatology within their clinics. My recommendation would be, I would find the nearest dermatologist that's close to you and have a conversation with them and develop a collaborative partnership with them. Because in rural areas, collaborative partnerships are one of the keystones to them to continue providing care to the population in an effective and efficient manner, right? because realistically, if you're a rural hospital or a rural clinic, your budget is not the same as a large for-profit hospital organization that can go out and offer these specialists, 20% higher than what the national salary is for you to recruit them out to come work for your organization. So my main thing that I would tell you guys is that when you're looking to create these new programs, or if you're looking to create a program to help complement your population health efforts, look into organizations either that are close, that you can develop collaborative relationships with, because that can save you a lot of time, money, and resources in the long run. Because in retrospect, and I've helped develop some of these type of relationships, and specifically here in the state of Tennessee. And what I did was I had a few FQHCs who didn't have access to a dermatologist. Well, I knew a dermatologist that was through one of my healthcare organizations that I'm involved in, and I had a conversation with him. I had a conversation with FQHC, kind of gave them a background of what type of organization they were, what type of patients they needed that the FQHCs cared for, and what type of time and access could he provide to that FQHC to see those patients. And as he was providing those consults, that the dermatologist was just billing for him on his end, so it cost the facility no money at all. So there's a ton of ways you can create those collaborative partnerships and relationships with other organizations that may have a specialty that you lack, and where it benefits both parties, and it's not just you letting the patient leave your group to go to another group, which you're keeping the patient within your group, but you just provide them with a service that they need in order to continue to help them improve their overall care. So collaborative relationships would be my main recommendation for rural and critical access hospitals, because it's going to be a must moving forward. Yeah. You got any more questions?
I think that'll be good for now. We do have one a question about remote patient monitoring and how to help with, in quotes, compliance and engagement of patients. Sherry from Texas said that they'd had a program that engagement and participation was a bit of a struggle.
Yeah, and that's common, realistically, because what I've seen when it comes to engagement, if the organization doesn't spend enough time really educating the patients on why they're a part of the program and all of the, let's say, services and things they're going to receive throughout the program, then you tend to see utilization kind of lag, right? And if the touch points, and if, let's say from a care coordination perspective, if within your program that you created, if there isn't weekly touch points, or what we call now is a virtual check-in, to where you have either a nurse or a care coordinator reaching out to a subset of patients just to check on them to see how they're doing, even if the patient's numbers are looking fine based on the data that you see in your platform, those virtual check-ins are extremely important. And luckily, CMS finally put the virtual check-in as an actual reimbursable service. So now all those calls that your nurses or care coordinators are making, reaching out to these patients that are less than 15 minutes, I think that's the criteria, you can now be reimbursed for that. So I just think having great communication plans and efficient touch points with those patients will always help increase utilization. But a lot of the education on the front end, and when it comes to selecting the patients, it's got to be done at that point, that particular point, Because if you tell them, hey, you're getting a free iPad, you're going to get a free glucometer that has it's a Bluetooth-enabled glucometer, or it's a cell-powered glucometer, and you don't have to do anything but take your A1C, and it automatically pushes the information to us. A lot of people will take it because they feel like they get free devices, right? But if the education at the front end and the selection criteria of the patient and making sure that the patients understand why they're participating in this program, and as you're running the program, right? Because just like with any population health or remote patient monitoring program, you can't just keep all the patients on it all the time, right? So you got to think through how do you graduate those patients, right? Okay, well, the patients hit this criteria, then we're going to tell them, well, congratulations, you completed the program. You either get to keep the technology and we'll keep seeing you, et cetera, and you pull in more people. So you have to think through how does that look, because, in rural areas, there's a lot of patients with multiple comorbidities. And if you let's say, for instance, if you focus on something as specific as diabetes, your panel will be extremely large. I know here in Tennessee, it's like that. I had a few groups that tried to take that approach, and it didn't work too well because it was too many patients, and a lot of people met the criteria. So just focusing on the selection criteria and then the communication plan to the patients, and then the engagement piece, either on a weekly or biweekly basis, especially with those very critical patients, to make sure that they're staying up to par and that they're doing exactly what you need them to do in the program, which will keep them engaged,
Thank you, sir. I'm going to advance it. I'll send you to your last slide about next steps, and then I'll ask Andy to put up those polling questions. We've got about 5 minutes left, so I will encourage people to continue typing questions and that conversation, as well as start thinking about some questions for Josh. There's a ton of information, and we can always get to slides and have you guys review slides afterwards, but we can get questions answered as well. But I want to make sure we get some questions answered if we have it.
Yeah, sure, no problem. I think I got a little lost with time, so I apologize.
No worries. It's all great content, and there's a lot of information, especially now related to telehealth and mobile providing care. So no worries, absolutely.
Yeah, but the last slide is it's all about the barriers. There were a ton of barriers that really, caused a lot of organizations not to adopt telehealth on a mass scale. But a lot of those barriers are being resolved, and due to COVID, we've seen a lot of legislation, and it's looking good. So hopefully moving forward, telehealth will be one of those things, just like any other piece of any other part of the healthcare industry that you actually provide to a patient that you're able to be reimbursed for it. But next step with me, what I tell everybody that, every person that I engage with, or every group that I engage with, is you got to start planning for the future now, right? So immediately evaluate your current market, do a market analysis, understand where you stand in the market, what is your market share, what is your strongest service lines, what new service lines are you trying to get into, et cetera. Do a whole entire market assessment / telehealth assessment to know where you stand, right? And then secondly, you have to review your state and federal guidelines, right? Because every state is a little bit different, especially Medicaid, So it's very important to review your state and federal guidelines. So as you're planning and you've identified the areas where you want to improve in, from a state and federal perspective, you know where your red tape is and what you can and can't do. And third is look for funding opportunities, because with COVID and what we've seen in the past 3 months, there's a lot of money out there available for organizations that's looking to expand their digital and virtual health efforts. And especially if you already have an existing population health program, you can always apply for some funding and look and focus on telehealth and digital health to expand and accelerate what you do. So look for all of those funding opportunities. And if you look out, like HRSA is a good place to look. The USDA, even look at CMS. They have a lot of new stuff that's coming out too. So look at those resources and see if there's any opportunities for your organization. And then you'll be at a point where you can really start, planning the implementation and doing all the other pieces of work that you need to do to ensure that you have a virtual presence and that you have something that's supporting your program. But those are my 3 biggest recommendations with all of that.
Awesome. Great. Thank you very much. Are you able to, so thank you everyone for taking the time. Thanks, Josh. As you ask questions and things, please take a moment to complete the polling questions. These are polling questions not just for today's presentation and discussion related to population health, but also beyond, and discussing the entirety of the Learning Collaborative. We will send a SurveyMonkey questionnaire to you guys as participants to solicit feedback related to the Learning Collaborative, the team's environment, and the format and structure of this Learning Collaborative, so we can ensure that we're making the process improvements needed to continue to provide education that's beneficial and helpful to you guys. Can you talk about the benefits related to, I know there was a discussion in the chat box related to antibiotics and antibiotic stewardship. I know that one of the providers that I'm familiar with is, and a couple doing telehealth have talked about the great benefits that antibiotic stewardship or telehealth can provide toward or related to antibiotic use and stewardship. Can you touch on that just a little bit, especially related to COVID and coronavirus and the I guess, thought or fear that there might be an uptick in antibiotic prescriptions being written, but how telehealth is another option for helping address that?
Yeah. And with that being said, man, telehealth is just that additional touch point, that additional clarification that the physician uses to really assess the patient's problem, right? And have, and say, for instance, it's a storm forward situation, and it's a situation where the patient says, well, all I need is, it's a sinus infection, all I need is some antibiotics and I'll be fine, right? In a situation where you have a provider that's backed up and don't have capacity, or if it's being done by a nurse practitioner or a PA, et cetera, you may have a situation where they do prescribe the antibiotic, just to give the patient what they need so they can move on to the next patient. But there's a lot of collaboration in reference to antibiotic stewardship with providers and using telehealth just for that initial screening piece with a nurse or whatever, a nurse or any clinician to say, okay, here are the symptoms, here's what the patient is complaining about, what do we recommend? So I've seen a lot of groups using telehealth just for that additional communication piece on the front end, so that they can make the decision from a from a clinical perspective, from a medication perspective, what is the best thing to be prescribed to that patient. But again, in the situations where I've seen that, in the collaboration I've seen, it was collaboration amongst multiple physicians. So when you, especially those work closely within the same area, you have patients bouncing around, kind of similar to what they're doing with the whole opioid thing. They communicate efficiently at the beginning to say, hey, well, I already prescribed the antibiotic to this patient X amount of times, and they have access to the information through an HIE, to where then they can provide another medication that would do that patient better and not have them, gain what do you call it when a patient takes a medication and the antibiotic gets kind of used to what you're taking it for? I'm a loss for words.
Yeah.
I can't think of the word. I apologize.
Resistant.
Yeah. Become resistant to the antibiotic. So just keeping that communication and that initial screening process by using digital and virtual health or telehealth, whatever form you want to use, to help mitigate some of those unnecessary prescriptions being sent from an antibiotic perspective. But it's a collaboration from a pharmacist and the primary care physician too. So when a primary care physician has a question, they beam in with the pharmacist to ask the question, or the pharmacist reviews the case, and bam, they have an alternative to that. So that's where I see it most effective. There may be other groups doing it in other unique, innovative ways, but that's what I've seen.
Awesome, and that's great, and it's good to have some examples and utilization or uses of it. And then we have another question from Sherry asking whether or not you have an evaluation template for rural hospitals to use to help determine which remote patient monitoring or chronic care management program they ought to start with, other than the volume or certain patients with certain diseases like you were referencing. If everyone in your patient population has diabetes, maybe we don't start with that. Maybe we start with a smaller group, get the program stood up, and then we advanced. Do you have suggestions, or is it kind of best to develop that with the program and the facility and providers on hand and need?
Normally, yeah, it's best to do it that way. But you know, it also plays back to your payer mix too, right? So when you're looking at your payer mix and you're looking at the total cost of care for all of your patients per payer, you know, that kind of can help you determine, you know, what specific condition your organization needs to focus on when you look at the total cost of care of each of those patients or all of those patients that present with those conditions. So with an